I'm going to show you how to save a lot of time asking the patients to fill their own data online before coming to the clinic. I'm on the patient, the practitioner is Joella Erika, and the patient's file is Carol Peter. I double-click to open the case. I go to patient's card, and I see that I have a certain number of things there, including the email, the WhatsApp, and the mobile number. This is enough for me. Even if I have only the mobile number, I can communicate and ask the patient to fill their own data. So I click on that. I can send a request to the patient by email, or I can send an SMS if I have SMS. Let's check how we can be sure to have SMS. If I go to utilities, if I go to SMS, I will see there that Joella Erika has a total of 10 SMS. She can send 10 SMS. If she wants to have more SMS, she can request for more SMS, and this is done online, and the company ANPA will be able to distribute the SMS needed. So let's go back to the case. SMS, if we have SMS. If you have no SMS, you cannot send SMS. Then WhatsApp, so you can communicate by WhatsApp to the patient, or you can copy and paste and use this data, which is the link to update the patient's file, will be done in a letter, an email, or whatever it is. So I click on WhatsApp, I click on email, send successfully. I go to my emails because I put my emails in this case to show you. So the patient, Joella Erika, is sending that to the patient's Carol Peter, and I click on the link. When they click on the link, almost all the time, they are working on a phone. So as long as they are working on a phone, they will receive the data like this. Mrs. Carol Peter. We need to select a nationality. Okay, Andorra. We need to add the date of birth because this is a wrong date of birth. So we change it for 1078. And the gender, female. And we get the mobile number. And if the WhatsApp is the same as the mobile, we click on same as mobile and we did the WhatsApp number. This will be very easy for the patient to fill that. So they will fill the residence status, and they have their ID card that they can put here, or if they have no ID card, they can put the passport over. They have all that at home. No need to do it at the reception the day they show up. The insurance details, it's very important also. So if they have an insurance, you click on insurance, and you have all these fields to fill by the patient. The chief complaint is about the dental. You can change all this list, of course. You can reduce it. Then the medical questionnaire. So you have that as an example. You can bespoke all this, vitals and allergy. When all this is done, so let's go to allergy. Yes, it is minor, and we have allergy to, let's say, aspirin. Okay. So now the patient at home will fill that and submit. When they click on submit, they have a small pop-up window like this, and they know that it's been submitted. You click on OK, and we are going to check together what's happening on the file. So on the file, you have the patient's card, and you have all the data which has been filled here, and all details which have been modified, if any. So when we go to the chart, what we have also is that we have the allergy to medicine minor with aspirin, and it's coming here. No need to go anywhere. Everything you have is at the first level, so it's very easy not to forget and make a mistake. So this is the way to ask the patient to fill their own data instead of spending time at the clinic to print something, to tick all the details of that and to copy that and making mistakes and all that. This is very easy to do, and the patients are very happy to spend time to update all their data at home. Thank you for your attention.